Welcome back. We have to deal with this measles situation because the CDC says there are now more than 100 confirmed cases of measles in 14 states across the U.S. Remember, in 2000, they said that there was no more measles, and the reason was because there was herd immunity because of vaccines. All right, so what does that mean? Well, the CDC says people aren't getting vaccinated as much, and as a result, kids are going to get sick, adults are going to get sick. Let's discuss this. It's urgent enough that Republican Congressman Tim Murphy of Pennsylvania is holding a hearing on vaccine effectiveness later this morning. Congressman, it is good to have you. I know you're talking the flu vaccine and measles vaccine, but you do have a common group of issues involved. Politicians are getting involved here, not the way you are productively, but they're talking about it. We have Chris Christie and Rand Paul. Let's listen to what they said.
All I could say is that we vaccinate ours, but I also understand that parents need to have some measure of choice in things as well. So that's the balance that the government has to decide.
I've heard of many tragic cases of walking, talking, normal children who wound up with profound mental disorders after vaccines.
Now, Congressman, you know, they're both Republicans. You're a Republican. I know Rand Paul is trying to figure out which way he wants to go. But when you look at this issue, are they pandering, or do you think there is a basis for skepticism about the measles vaccine?
I think the issue with vaccines and whether or not mercury that used to be put in vaccines over 10 years ago has an effect upon autism has been repeatedly dispelled. Lancet magazine published an article about 1998-99, and since then has retracted it, saying the scientist who published that falsified his data. There is not that link. Certainly we are very, very concerned about the increase, the rise in autism, and we should feel compassion, and it should drive us to do the right science in dealing with vaccines. But I don't want us going down the wrong road here and leading to panic. Look, there's a couple areas that are important in what we're going to deal with this in our hearing today. Primarily the ineffectiveness of the flu vaccine, where we may have 50,000 deaths this year, and then of course it will lead over to other questions people have about measles and not getting a vaccine, and we hope that that doesn't lead to some deaths, but there's chances of that. It's growing at twice the rate of last year, measles, and it's about 10 times the rate it's been over the last 10 years. So they're both big concerns.
Right, but let's unpack it a little bit. First of all, both of their campaigns, Christie's office and Paul's office, both came out and made corrective statements that really adhered much more to conventional thinking, which is kids should get vaccinated, especially for the measles. But that goes to why we are engaging this paranoia. Why are we doing this? Why are we presenting this like there is a debate as to whether or not you should get your kids vaccinated and saying parents should have a choice? Well, they do have a choice, but should you think ever about not vaccinating your kids unless the kid has a specific immune issue?
I think the science is pretty clear that says there's a greater value to having a vaccination done for whatever that is, and the other risks that people are talking about simply have not been found in any scientific study, period. And I think it is important for people to get vaccinated. What I'm concerned about is when we don't get the vaccines, the harm is much greater. When we have, we're going to be asking the CDC and others today, how did they mess up this reading of the flu vaccine where they knew last September that it wasn't going to be effective?
So that's a different issue, right, Congressman? That's not about let's not get vaccinated for the flu. That's about the effectiveness of the vaccine and what we're able to know and what we should do to prevent.
But in each case, what I want to see the CDC do is communicate to the public. They need to have these things done and tell people the scientific reasons. I think the silence is a huge problem when you see over 100 cases coming out of Disneyland alone and the association with there. And keep in mind that measles can spread just from the air. Flu can do those things too. CDC needs to be out front with sound information. Heck, when we had the Ebola issue, they were on the air every few minutes talking about it. They need to be doing a lot more with public factual information so it does not become a scare in any of these cases.
Because now when you have the flu vaccine not being that effective, it fuels skepticism about getting vaccines in the first place, right?
Exactly.
People are like, it doesn't even work. Why would I get that? Even though any vaccine you have is going to make you much less likely to get sick. So what do we do here with the measles situation? Because, it's being presented as a debate, and I've been saying all morning, I can't have my kid bring peanut butter to school, right? Because there's a presumption someone may have an allergy. You got much better chances now with measles and and the flu vaccine, getting the flu, but we're not making that mandatory.
Well, Chris, you're bringing up a great point. It's the issue when you have a little bit of bad science goes a long way in creating a myth and a legend, which creates more harm. And then when you have, I mean, look, in the Energy and Commerce Committee, which I serve, there's been hearing on this in the past. People on both sides of the aisle have made mistaken statements about the impact of vaccines and developmental disabilities. I've worked with many a child in my career with developmental disabilities, and believe me, I've seen all sorts of things out there from food allergies to special diets to even corporal punishment as a way of dealing with autism. None of those things bear out. What we have to do is focus our efforts on doing the right thing, but not these scares based upon no science.
Look, what we do know is that the saturation of vaccines have gotten much less, right? We're much more effective at administering vaccines than we used to be. And the number of diagnoses of autism has gone way up as the definition of it and the spectrum of it has broadened. People have to understand those aspects as well. But let me ask you, what do you do with the CDC to get them better on the flu vaccine? You say they face challenges. What are they, and how do we overcome them?
Well, the flu vaccine, a huge problem. Around March of last year, they showed up with 17% what they call the miss rate, that it wasn't going to be effective. Something new was developing. And by September, they knew 50%. It had grown considerably. CDC made a determination, actually the World Health Organization says, you know, in the Southern Hemisphere, let's vaccinate people against this other flu. But they maintained in the Northern Hemisphere. What I'm concerned about here is I think they had time to make a change in this. And the fact that seniors in particular are at very high risk for illness of the flu and death, that they should have done more early on. They could have developed an alternate vaccine. They did in the past in 2009. They didn't do that. We've got to get to the bottom of this. Who made this decision? What was this based on? Where was the science there? Because now we see the harms coming out. And again, it deals with the issue of the credibility of the CDC and their statements. Their silence on one hand and giving statements that I think are weak on the other.
Representative Tim Murphy, this is important stuff. We're going to monitor the hearing today. Thank you for joining us on New Day with some advance notice.